Welcome back to Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we're talking today about colorectal health. We're looking at prevention, diagnosis, and treatment of cancer. We looked at the family practice level in our first segment, and next we'll be diving into specialty care. I have as our next guest Dr. Suma Satti. She's a hematology oncology specialist at St. Tammany Cancer Center, a campus of Ochsner Medical Center. Welcome to the show.
Thanks for having me.
Dr. Satti, so tell us a little bit about your background to start.
So I have worked at main campus Ochsner for since 2008, trained and did my fellowship there, and stayed on because I fell in love with the city. And recently I've started coming to the North Shore, and I really like my experience here. I've been serving as vice chair. We have started some special programs up here, which would be like a multidisciplinary program. I know you're going to talk about it in a little bit, but we have a multidisciplinary approach to cancer care, and we'll dwell more into it. But that's just the best way to do oncology, and it just gives me excitement to bring that to this part of this
Fantastic.
state.
Well, I know you're right. I do want to talk multidisciplinary because I think it's just a game changer in cancer care.
Yeah.
But if you can just start off with the role that your specialty, hematology oncology, plays in a colorectal cancer diagnosis.
Yeah. So we do see patients after their diagnosis most of the time. Sometimes we see them because they have anemia and they end up with iron deficiency, and they get referred to us for that, and then we end up finding the colon cancer. Because anyone with an iron deficiency anemia should have a colonoscopy after a certain age.
Oh, wow. Okay, so someone may just be experiencing anemia, have no idea that what they have is cancer, and in the process of trying to treat that anemia,
sometimes we diagnose cancer as a cause.
Oh my word. Boy,
Yes.
Cancer is serious business, and I'm so grateful there are people in these industries and in these areas of medicine that just have this knowledge, and we've coalesced them together in the Cancer Center. So I think if you can talk a little bit about the sort of treatments that are available, you know, once that diagnosis happens.
Yeah. So if you're talking colorectal in this segment, basically when they get diagnosed, most of the time they end up seeing a colorectal surgeon, unless the cancer is spread at the time of diagnosis. Colon and rectal, we're talking both. So it depends on the location of the tumor, whether it's in the colon or the rectum. They get referred to a colorectal surgeon, a medical oncologist, and a radiation oncologist. Radiation oncologist is usually for the rectal cancer diagnosis. So that's where the multidisciplinary care comes into place, where we review all these new cases and decide what's the best treatment approach for them. So we are a group of doctors who sit together and do only colorectal that whole hour. And then we have a multidisciplinary clinic where we see the patients in the same setting. So whoever the patient needs to be seen gets seen. So that's how we do it, so that we save time for the patient and also get the things done, get the ball rolling quickly for the patient.
That's what I'm thinking. From that multidisciplinary team standpoint, when you all meet for your multidisciplinary team hour, you're focused on specific patients, specific cases.
Yes.
And you're sharing those, and you have radiation oncology, hematology oncology, medical oncology, you have surgeons, you have every area that might need to care for that patient.
Correct.
Looking at that individual human being's case.
Right.
And figuring out, among our areas of specialty, these are the things we need to do for this patient.
Correct. And we also have pathology, radiology, nurse navigators, social workers, research, everyone on that meeting.
That's fantastic.
So we can look at each case, we review the case, we present the case, and we tell all the information that's available, review radiology, review pathology, and then decide, okay, this is what we would recommend for the patient. So all recommendations, it's not like anyone is forced to do anything. This is just recommendation with everyone sitting together who do colorectal cancer for a living, basically.
Right. And so all of those colorectal cancer specialists are bringing their area of specialty into the room and focusing together and making a recommendation. But then when you talk about the multidisciplinary clinic,
Correct.
That's a step beyond the meeting.
Correct.
Because you're talking about these areas of specialty actually being available to the patient
Correct.
in a same day or in a really
Correct.
tight couple of days.
Yeah.
So that you are speeding up those second opinions and the visits even.
I think you hit the nail on the spot. So basically, when patients get a diagnosis, there's always this time that is lost trying to find a cancer doctor, then trying to find a surgeon, then trying to find, there's like weeks and weeks go by. And oftentimes we see 6 weeks, 8 weeks has gone by, and what could have been an early cancer can become advanced in that time. So we don't want that to happen, because cure rates are higher if it's an early cancer, and it's an advanced cancer, it can be incurable. And sometimes cancer doesn't read a textbook, so it can grow fast. So the advantage of a multi-D clinic is we are there. All 3 people that are involved in colorectal cancer are there. The navigators know what days those are, and navigators are the people that navigate patients through the system. That's their job. So their job is to make that patient who has a positive colonoscopy come in, see the colorectal surgeon. If it is advanced, they set it up with a medical oncologist. If it is rectal, automatically you get a radiation oncology opinion. So what we try to do by doing that is we're all there, so we can see the patient one after the other. So the patient gets all the opinions and the treatments start rolling. So you're not having this 2 weeks or 3 weeks or 4 weeks lag period in taking care of the patient.
Oh my goodness, that is fascinating.
It is. It works well.
And I think when you realize that all of that is available in St. Tammany Cancer Center, a campus of Ochsner Medical Center, that those partners have pulled that level of specialty together into
Correct.
that one place.
Yes.
And as you're saying, if you're not experiencing that kind of coordination, then you're kind of your own navigator, and you
Yes.
need to find yourself a surgeon, and you need to find yourself a radiation oncologist, and you need to find yourself a hematology oncology specialist. And you've got to try to coordinate your care, and that sounds a little bit overwhelming.
It is very overwhelming for the patient. Plus, the patients are not supposed to be doing that. You know, we have to take care of the patient. You know, that's our job. So having that system integrated makes a big difference for them. You know, you have, and they're all their records. They have everything at their fingertips. So they have a question, they don't understand something, they can see my note. As soon as I sign it off, it'll show up in their in-basket. They can see the scans, they can see the labs, they have everything at their fingertips, so they don't have to go around looking for things. It can be very overwhelming with a diagnosis like that.
I love that. That's Epic, or my chart that you're talking about, that the patient themselves can see what's in there.
Yes.
And every specialist on the case can see that
Correct.
information.
Correct.
And I think, along with the multidisciplinary team, the other thing that I think is hugely important about working with a large organization like St. Tammany and Ochsner is clinical trials.
It's absolutely.
So can you talk a little bit about what's available through our cancer center?
Yeah, we have tons of trials available, and we decide during the tumor board what the patient qualifies for also. So the research nurses are part of the tumor board. So we, when we do the multi-D tumor board, the research nurses are also in there with their list of trials, and they screen the population before and say, hey, we think this patient qualifies for this, what do you think? Because the trials, there are so many of them, they come and go, so we want to be at the cutting edge. So we include the research nurse on the board, tumor board, so that if we see something and we think the patient qualifies, we evaluate and we project that information to the patient. And obviously we're not making the patient sign up for something if they don't want to do it. It's completely voluntary. So we tell them, hey, this is the standard of care that we would do. This is the trial. Why is this better? Why would you do this? Things like that. Because we want to give them cutting edge treatment. We want to be able to work with the patient to decide what they want to do.
That's fantastic. And so you're able to connect them with clinical trials from almost anywhere.
Correct.
And so they wouldn't have to travel.
Correct.
They'd be able to be under your care close to home.
Yeah, and we are actually trying to expand more on the North Shore. We do have, obviously South Shore has a bigger research thing,
Sure.
and North Shore is a little bit smaller, but obviously we are smaller compared to the South Shore. But our goal is to open up more trials over here so patients don't even have to travel across the lake.
Well, and if you do have to travel across the lake, that's not having to go to Houston. It's
No,
not
it's
having to
not.
go to Baton Rouge. It's just
not.
across the lake.
Exactly. And trials are like so important nowadays with the way the oncology is running. Literally, it's running. Every day we get a new approval. Every day we get a new indication. So if the doctors are not staying up on cutting edge and patients are not given those options, you're not really going to make progress in that field.
Got it. Dr. Satti, thank you so much for coming in.
you.
This is fascinating.
Thanks for having me.
You're watching Healthy Living, brought to you by St. Tammany Health System. We'll be right back.